Assalamu alaikum everybody. Today we are going to discuss on why diabetic patients struggle with wound healing. But before I go further, if this is your first time seeing my video, please follow my TikTok account, subscribe my YouTube channel. Let me give you 2 seconds to do these things. After this, let us continue. Why diabetic patients struggle with wound healing? There are so many reasons whereby a diabetic patient will struggle with wound healing. Number one is there is impaired blood flow. Whenever there is high sugar level in our blood, there is going to be what we call vasoconstriction. The blood vessels will constrict, reducing blood flow, oxygen supply, nutrient supply to the extremities. And this reduction of oxygen and nutrient to the affected area will slow the wound healing processes. Number 2 is neuropathy. Whenever there is high sugar level in the blood, there is going to be a nerve damage, whereby a diabetic patient will lose his sensation. He will only feel numbness, tingling, and at all he will lose his sensation. Whenever he gets injured, he will not be aware that he have an injury. He left that injury to be untreated. That injury will take too much time before it will heal. Number 2, diabetic patient immune is very weak. Whenever he gets injury, that injury will continue rising. That is why some of diabetic patient will be seen with amputated limb. Why? Because there is weak immune system. Whenever they get injury at the leg, more especially at the leg, they will not be aware that they have that injury, and that injury will take too much time before it will heal. Number 3 is collagen synthesis reduction. In the body, we have a protein called collagen, which is very important in wound healing processes. So for diabetic patient, there's going to be a reduction in the synthesis of that collagen. And after that, diabetic patients, they are at risk of inflammation. Whenever they have an injury, the inflammation process is very common for diabetic patients. So, and I have some advices that I will give to diabetic patients in order to prevent themselves with struggle with wound healing. Number 1 is regular sugar monitoring. Regular checkup for sugar monitoring in the hospital or at the house in order to maintain the sugar level in the blood. Number 2, taking insulin injection as prescribed by the physician. These are some of the advices that I will give to diabetic patient in order to prevent himself from struggle with wound healing. That is in short on why diabetic patients struggle with wound healing. Last, as you all know, my name is student nurse Usman Abdulkarim. Please subscribe my YouTube channel, follow my TikTok account. For any observation, comments, suggestion, the comment section is already there waiting for you. Thank you all. Thank you.